It's very common for patients to attend the GP practice and say they have sciatica, and they're meaning back pain or problems with the leg. But what actually is sciatica? Well, let me show you. So here is a leg, and typically the pain for sciatica has to radiate from the buttocks or the back all the way down the leg. And if I remove the muscles here, we can see why that is. The sciatic nerve runs all the way down from the buttocks, behind the knee, down into the calf, and finally into the foot. So if you've got compression here, it's going to cause fire-like pain right the way down the inside of the leg to the knee. Now, for many people, sciatica is a problem where one of the discs has slipped and is squashing that nerve, causing the pain to radiate down. However, that is not the case in all patients. If we look again at this patient's hip, we can see the sciatic nerve coming out between these two muscles. We can have something called Piriformis syndrome, where the sciatic nerve, rather than running between the piriformis muscle, actually goes through the piriformis muscle. Ergo, when the patient is walking, when they're contracting these muscles, that's going to keep squashing the piriformis nerve. And should that muscle contraction become sustained, so for example they have a pulled muscle, the muscle goes into spasm, etc., that can cause a sciatic issue simply due to a muscle issue. It's one of the reasons that we will recommend patients to see a physiotherapist when they have sciatica, because yes, it may be a problem with the spine and maybe the physio will be able to help at that point. However, if it is purely a muscular issue, that is where the physio is likely to have the biggest impact. And we always want to make sure that we can maximize the opportunity to help a patient through non-medical, non-surgical approaches where there's very little risk and potentially a significant benefit, particularly if we're talking about a muscle problem. Take care, and we'll see you in the next one. Cheerio.